Good afternoon. I am Tacey Goheen, the Director of Community Services here at Still Hopes, and so glad to be with you. Need to say at the outset that Dr. Hirth and I are filming this segment of Healthy Dynamics on Monday, February the 15th. It will actually air on Thursday, February the 25th. And so with 10 days between filming and airing, as we know, things can change daily in this COVID arena. And so just be aware that things could change between then and now. But glad you are all here. So glad to be back with Dr. Victor Hirth again, who is our medical director in our licensed areas. And of course, with geriatric health and wellness as our doctor for many of you here on campus in our apartments and cottages. Our program today focuses around COVID-19, where we are, where we go from here, given the vaccine and other developments, and what the future may look like. So without further ado, we'll dive right into questions. So Dr. Hirth, just wonder if you might have an overview as to where we are now, sort of from where we started some months ago with COVID, and sort of where we are now and where we may be headed, and your thoughts on that.
Well, we've come a long way with the whole COVID vaccine, COVID infection episode starting from last March to current. In terms of more recently, what we're seeing are lower rates of infection, lower rates of positivity, less activity among the Still Hopes residents, both on the skilled side as well as independent. So that looks promising so far. It looks like maybe we're turning a corner, not only here on campus, but maybe statewide, nationwide.
Also, some things about the vaccine. Would you recommend the vaccine for everyone? Is everyone an appropriate candidate for the vaccine?
Yes, our recommendation is that everyone should be vaccinated against the COVID virus.
Also along those lines, our residents have asked if I've already had COVID-19 and recovered, do I need to wait to be vaccinated, and how long do I need to wait?
Yes, so if you've had the infection, the recommendation from the CDC is that you wait 90 days post-infection prior to receiving the vaccine. In terms of receiving the vaccine versus not, the recommendation is to go ahead and get the vaccine because it's not known how long the natural immunity from a COVID infection lasts. But in general, 90 days after the infection, you are safe, it's recommended, and it should provide prolonged immunity.
This one relates to treatment, and these are questions that came from our residents, so we're really excited about that. Tell me about current treatments for someone who develops COVID-19 virus. I've heard something about infusions and things being offered, but don't know a lot about that.
Yeah, so the current treatment, I'll speak mainly to outpatient treatment since hospital treatment is a little different. For outpatient treatment, we only have two therapies. They're both emergency use authorization drugs, which are infused antibody against the COVID virus. Those are available here locally at a number of sites. We've had very good luck getting our patients set up for the infusion. The infusion runs for an hour. There's an hour of observation for adverse events after that, and then the person comes home. There's data that the antibody infusion reduces the risk of emergency department visits as well as hospitalization, so it's definitely worth considering. It's currently recommended only for high risk, but in general, our folks' age plus one medical condition puts you as a high-risk category.
How long does it take until I am immune from COVID after my second vaccine? We've seen some updates on the quarantine issues and all come out from the CDC just the end of last week, so that certainly plays into it. They give sort of a 2-week afterwards to 3-month afterwards window, but just your thoughts about that.
So the immunity is thought to occur somewhere between 2 to 4 weeks after the second vaccine dose is administered. What we don't know is how durable it is, that is, how long will it last. The efficacy is 90 to 95% for most of the vaccines. They're the two that have emergency use authorization, Moderna and Pfizer. There's a new vaccine coming that hasn't received emergency use authorization yet from Johnson & Johnson that has slightly lower efficacy.
If someone does develop COVID after receiving both doses of the vaccine, will they have a milder case?
That's the thought, that generally they already have an immune response. They should be able to fight this better and would have a less severe case of COVID.
Since almost all residents received the vaccine, is there a time when we can stop wearing masks and look forward to gathering without social distancing? And that may be a, a pie in the sky question, but it's one that we're all wondering, I think.
Oh, that will be nice. Unfortunately, the recommendation still is, even for campuses or people who are fully immunized, the recommendation is to continue with social distancing and mask usage until there's further guidance from the CDC.
What about the new strains of the virus? How concerned do we need to be about those?
So there are at least two new strains, a South African strain and a UK strain. My understanding is both of those variants are in the United States. There's concern that they might be more infectious than the current strain. Whether they result in more severe illness or not is not entirely clear. It's only one of those things that we can just watch and see how this plays out. I'm not aware that it's becoming a significant proportion of new COVID infections yet at this time.
I've heard Moderna is developing a booster vaccine potentially to address those new strains. And is that true? And any information on that would be helpful.
Yes, Moderna is developing a booster vaccine. So this would be a third injection after the first two for, I believe it's the South African strain. The booster is currently in testing. It's not received emergency use authorization yet at this time, but we'll probably hear more in the future.
This sort of relates to the vaccine and the yearly outlook. So residents are wondering, will we have to be vaccinated every year like we are with the flu, or is this a one-time or a two-dose vaccine, or maybe we just don't know yet? So that's another good question.
Yeah, so that we won't know for a while, and it's all contingent on how long the immunity lasts in the general population. And since it's so early in the history of people being vaccinated, we don't know if the vaccine immunity will last for 1 year, 3 years, 5 years, indefinite. We just don't know at this time.
A resident, or a couple of residents actually, reached out about this. I came down with COVID after receiving dose 1 of the vaccine and was unable to receive dose 2 at the appropriate time. Do I have to start all over with dose 1? And there could be others that didn't come down with COVID, but for some reason or other didn't receive dose 2 at the 28-day mark. So just some information about that would be helpful.
So there's no recommendation to repeat the first dose if the interval to the second dose is prolonged. In general, the recommendation is to try and get it within 6 weeks. If there's been an intermediate COVID infection between the first and second dose, generally the recommendation is to wait for the symptoms to resolve prior to getting the second dose of vaccine.
Have the statistics changed much? I think that's a really good question. With the whole COVID pandemic, have the statistics changed as far as incidents of mortality, things like that from COVID?
So it looks like nationally that the incidence of both positive tests and COVID infections are starting to drop. There are still some hot spots in the country. South Carolina looks like it's starting to peak. That is, that we've hopefully reached a maximum and now are declining. We're seeing that in Lexington County as well.
We are getting information weekly now from Still Hopes about positivity rates in Lexington and Richland County. What does this really mean, and how accurate are those numbers?
Well, we think the test is accurate. We have 2 tests that we use. The PCR, polymerase chain reaction test, is, quote, the fancy one. It's the more accurate one. It takes longer to get results. And then we have an antigen test, which is a quick, rapid 10 to 15 minute test, which is not quite as accurate. So we think the tests are reasonably accurate. Again, based on the testing being done, it looks like rates of infection are going down.
Another vaccine-related question is, can I just get one dose, or are 2 doses of the vaccine really necessary for any protection?
So it's important to get both doses. Clearly, 1 dose does give you some immunity, but it's not quite as significant as having both doses. The recommendation is that people should receive both doses. In general, the recommendation also is that you stick with the same manufacturer. So if you had a Pfizer vaccine for dose 1, you should have Pfizer for dose 2. Moderna, similarly, both 1 and 2 would be from the same manufacturer. In rare circumstances, it's acceptable to switch manufacturers because the actual biologic process of the vaccine effect in the body is substantially the same. But in general, you want to stick with the same manufacturer and get both doses.
What are the most significant symptoms residents with COVID are having? Is it taking them a long time to recover? Because residents have come to me and they have family members or friends or other fellow residents who have dealt with the virus and the aftermath, and so just curious about that.
Yeah, so that's a 2-part question. I think to clarify, in our population, that is the population of older adults, the symptom constellation looks a little different than the typical middle-aged adult, which is generally fever, cough, fatigue, shortness of breath, loss of appetite, loss of taste. The older adults, as they are with many other diseases, have slightly different manifestation. So the symptoms tend not to be as prominent. What we've seen here on campus is fatigue is a prominent symptom. It's frequently very profound. And then the others, in terms of loss of sense of taste, is also occurring. Loss of appetite, weight loss, loss of smell, not so much. Fevers, honestly, in our population seems to be infrequent, though we have had some people with fever. Cough is also relatively infrequent, but we've had a couple of COVID pneumonias. Those folks tend to have cough. Shortness of breath is variable. So I think the issue for mostly the staff, but certainly for our residents as well, is the suspicion needs to be high that something different or unusual could be COVID, because older adults don't usually have the usual symptoms. Makes it trickier to diagnose.
We are really concerned that even though almost all residents have been vaccinated, we're around other people who have not been vaccinated in the community, in families, and elsewhere. So does that mean we'll have to socially distance and wear masks ongoing, and what might that look like?
Yeah, so at least for the immediate future, the plan is still that everyone still wear masks, social distance, wash hands. The question in terms of everyone being immunized versus part of the population being immunized, in general, we would like everyone to be immunized, but I think the authorities are trying to have a happy medium between a mandate or requirement versus it being voluntary. It's currently voluntary. The more people who get the vaccine, the better off we'll be. But there are always going to be some people who can't take the vaccine. If you can't take it, you can't be forced to take it, because those people are at high risk for adverse events, and we certainly don't want to have that. So it's the best happy medium between maintaining hand washing, social distancing, wearing masks, getting vaccinated, and being careful, and then watching the evolution of this whole COVID disease epidemic evolve over time. It's clearly evolving. Whether it goes completely away or not, we won't know for some time.
And then I think a couple really good questions maybe to sort of finish up. What are the significant lessons that we have learned so far in this pandemic? We'll probably know a lot more in 10 years than we do right now is my thought about it. But what do you as a health professional see as something we really need to remember and focus on moving forward?
Well, I think since it's an infectious pandemic, just like the flu or the cold, being careful of hand washing, touching your face, how close you expose yourself or others are exposed to potential viruses, whether it be airborne or contact. Just having awareness of the ease in which these things can be transmitted, I think, is important. I think the bigger picture, because there have been so many limitations in terms of people's travel and visitation, and that is hopefully when things become a little bit more normal, is to value each and every day and make the best of it. For those unfortunate folks who've succumbed to COVID, there's no second chance of coming back to do the things that you'd hope to do. So again, I've been trying to encourage our folks, whether it be on the assisted or skilled or independent side, is to figure out how we learn to live with the virus. Because we can't live in fear and solitude and isolation, because the consequences of that have been also quite severe. So we have to find a happy medium where we ensure the safety of our residents and the campus, and yet still allow people to have social interaction, engagement, religious services, and other activities.
And then sort of related to that, of course, the $10 million question, when will we be able to get back to normal? I was listening to a speaker this weekend who said, you think about normal and you think about 9/11 and when that happened in 2001. Airports never went back to normal. It was a new normal. And I'm kind of wondering if that's going to be the case for this. So, but I thought that was a good analogy. So, how to take on normal?
The question that no one can answer, when will we be normal? Again, we're going to have to watch and see over time. Hopefully someday, but I gave up forecasting last year when I was wrong too many times. And honestly, I don't know that anyone can say, even the smart experts, we're just going to have to watch this and see how things go.
Dr. Hirth, just some really interesting things we're talking about today. Thank you so much for sharing your knowledge and wisdom and insight with us. But a couple things to follow up on. I love that you said value every day. Learn to live with the virus, at least for a bit anyway. A couple questions about that. What have you seen as far as emotional health and the toll on emotional health through this? And then I'm also interested in the flu statistics for this year. I haven't heard much about that at all. I think we've all been busy with COVID sorts of things, but would love to hear about those things.
So the emotional toll in terms of the social isolation and restriction has been pretty substantial. I would say much of what we've seen over the course of the past year has not been trivial. So we've seen more depression, more substance abuse, more social isolation, more physical deconditioning, probably more falls. Whether that's translated into more hip fractures, I'm not exactly sure, but certainly we've had people fall and have hip fractures. So there's been a cost to the isolation. And again, we want to encourage people to not sit in the apartment or cottage on the couch watching TV or doing crossword puzzles or what other activity that allows you to stay for long periods of time isolated, because that also has not been good. There's been a cost to that. So the human body was meant to move. We would like to see people get into a routine that somewhat resembles what they did previously. It might not be identical, but certainly for some folks who've been very concerned and cautious, they potentially have restricted themselves to the point of increasing the risk for other conditions and hazards. As it relates to the flu, so interestingly, prior to the epidemic getting completely ramped up, we knew from data from the southern hemisphere, which gets the flu first, that it was probably going to be a mild flu season. And so far what we've seen in the United States is confirming that it is a mild flu season. South Carolina, for us, generally the flu season, the peak tends to be now, and then March, sometimes a little bit of April. Knock on wood, we've done some flu tests, but we haven't had any positives yet. So it looks like this is going to be a very mild flu season. If it would have been a severe one on top of COVID, that would have been really rough. But it looks like the trade-off is not as much flu activity as previous years.
Also, a couple residents had just a general question about helping our friends, helping our neighbors, helping fellow residents. Is it appropriate to offer a medication that you have that might be helpful for someone else who seems to have the same sort of symptoms, either over the counter or prescription, or should we really shy away from that and refer them to their own medical professional?
So as it relates to the issue of sharing over-the-counters or prescription medicines among residents here, I would really highly frown upon that. I don't think it's a good idea, because the problem is, particularly for prescriptions, but also for the over-the-counters, you might not know what your friend across the hall has in terms of allergies, drug reactions. You almost certainly don't know what other medications that person might be on, and whether what you're recommending or bringing over might cause an adverse drug event or a drug reaction, which could potentially be very serious. I know the intent is to help out, but it'd be better to contact his or her local physician and have that treatment by a healthcare professional. So I would recommend that we not do that. That would only be with permission of a physician or other healthcare provider, which, again, it's unlikely that they would say go ahead and give them a pill, just because the risks are too great. So please would encourage you not to do that.
Thank you all so much for being here today. Really appreciate Dr. Hirth's time and insight and talents and information sharing with us on this really, really important topic that's on everyone's mind these days. So we'll see how things adjust and change in the future, hopefully in a really good way, in a much healthier way. Be sure to check this afternoon in your boxes for your chocolate that always comes with Healthy Dynamics. And maybe one of these days before too long, we'll be together again in the Keenan Center for these programs rather than on film. So thank you so much, and stay safe.